So at this moment we have Daratumumab indeed approved for various indications as monotherapy in advanced patients, in combination with Landex and in combination with Bordex in Europe, in relapsed patients, and also in combination with Pondex in the United States, while we are awaiting the results from the Apollo trial to also get Dara plus Pondex approved in Europe. But we have recently also seen the results from the phase 3 Alcyone study, in which VMP was compared with Daratumumab VMP in elderly patients with newly diagnosed multiple myeloma. And a couple of weeks ago, EMA also approved in Europe the use of Dara VMP in elderly non-transplant eligible patients. So Daratumumab is now an established drug in advanced patients, relapsed patients, in newly diagnosed patients, and these studies have really shown that adding a CD38 antibody is very advantageous for the patient in terms of progression-free and possibly also overall survival. Maybe another important issue for the patient and also for the daycare unit facility is that Daratumumab is now also being tested as a subcutaneous formulation, and hopefully soon this will also be approved based on a phase 3 study that's comparing subcutaneous versus IV formulation. And when subcutaneous is similarly effective and similarly safe, we can give Daratumumab in only 3 to 5 minutes via a subcutaneous injection, and no longer via the 6-hour and then 4 and then 3-hour intravenous infusions. So that will make the life and quality of life of doctors and patients much better, because we are always struggling with the limited space in the daycare unit, and of course the patient can go home much faster. We already have some data from a smaller study, the PAVO study, in which response was even a little bit better than with the IV formulation, but we have to be careful with small numbers in these studies and maybe a different patient population. But what's also important was that in the PAVO study, also the infusion reaction rate with subcutaneous formulation was lower, markedly lower, than with the intravenous formulation. But we have to see in the phase 3 Columna study whether this holds true.